welcome you to this lovely session that we have planned for you today with Dr. Jay. Thank you so much for being here.
Oh, nice.
If some of you are, is anybody here who this is the first time joining for one of CTA's events? Please write in the chat if you're new. Hi, Parija, welcome. Kala also joining us for the very first time online. Welcome, Kala. All right. So for those of you who are new, just a quick background about CTA. So we are a community for students and professionals in Ayurveda, and we organize online events where we get to speak with inspiring Vaidyas and professionals and practitioners in Ayurveda. We also organize community discussion forums, and very, very happy to have you here today. All right, so we have a lot of interesting things to talk about today with Dr. Jay. So I want to make sure we will have enough time for that. So maybe if we can get started, and a few more people may be streaming in as we go along. So welcome Dr. Jay Parla to our session today. This is the second episode of In Conversation with a Vaidya. And last month, we had the privilege of speaking with Dr. Jay Kodikanath from Kerala Ayurveda. So we have another Dr. Jay this month. And thank you so much for being here today.
Absolutely.
And I think there are many people joining today who may know you already as a teacher, as a mentor. We have students here who may be joining from Southern California University as well, Mount Madonna, Kerala Ayurveda. So I'm sure many of the students who are joining today actually already know you, but I would still love to give them a brief, we will start with maybe talking a little bit about your practice and get into some more questions from there.
Sure.
So Dr. Kala says actually, Dr. Parla is our favorite herbology teacher at MMI. So had to join.
Pleasure is mine. Thank you, Kalaji.
And then Grace actually is chiming in and saying, not only a great herbologist, but teacher and practitioner as well. Welcome, Dr. J.
Oh, thank you.
Lovely.
Thank you, Grace.
Lovely to hear from everyone. All right, so Dr. J, I'd love to hear kind of a little bit about your practice. You've been practicing in this country for many, many years. You teach, you practice, you also have your own, Athreya herbs, which creates Ayurvedic herbs and formulations. So we'd love to hear a little bit about your practice in Ayurveda.
Sure. Can we chant? And then that's what I would love to do. That's my favorite thing to do. We'll chant and then we'll get started, okay? So that we have a beautiful conversation with the permission of the Nandri. Namami Dhanvantarim Adidevam Surasurairvandita Padapadmam Loke Jararubhayam Mrityunasham Dataramisham Vividoshadhina Om Shanti 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 Hare Om. Thank you.
Thank you. That was beautiful. Thank you.
Yeah, thank you for having me. And I hope this conversation will help our fellow Ayurvedic practitioners and students to have an insight into how Ayurveda can be self-transformative and also beneficial for other people who need Ayurveda at this time. So to answer your question, Shruti, I started practicing here in the US since 2005. So about close to 15 years, 16 years now. Before that, we had a center in uh, Bangalore, which is a city most of you know. Bangalore is in southern India. And then for the travel reasons, the universe has a special way of saying, I support you. So we were practicing in Bangalore, and there was a group of Americans who were visiting for uh, it's learning Indian culture, Indian sciences. So they were touring India, and then someone said that you can also experience Ayurvedic treatments, which is like Indian medicine, and that's how somehow they tumbled upon our clinic, and we did whatever we wanted to, tell them and show them. Some of them had some health issues, knee issues, and like common problems that people face. And when they came to us, we did all the panchakarma herbs and all that, and some of them got curious what we were doing because they probably felt a relief from what they were experiencing, and they invited us to explain what we were doing. And when I say we, it's me and my wife. We both are Ayurvedic practitioners. So we started taking a blackboard and it's chalk piece, and in a modest way started explaining what we are doing and how Ayurveda works. And the zeal, the inclination, and then the desire to practice and teach Ayurveda uh, was in us to while explaining. And one of them was a public health professor from Jackson State University in Mississippi, and he's the one first invited us to come to US and talk about Ayurveda and Ayurvedic practice. So 2003 is when we landed in the US. No, sorry, 2001 is when I landed in the US. And then 3 years we traveled. And 2005, we decided that we come here because of, the purpose being, the purpose being that, we want to propagate this science. We want to propagate this science.
Right.
So that's how it started. That's the story of us, of me, coming here to the US. And since I came here, one of the universities that I was associated was then American University of Complementary Medicine. So I practiced there. I taught there and practiced for almost 5.5 years, 6 years. Okay. And within that time, Ayurvedic practice definitely grew quite remarkably. And that's what made my practice first in Beverly Hills and now in Long Beach. Right. So that's how my practice has rewarded my work here.
So as you started to practice, what were some common issues that people were coming to you for? What did you notice?
Good. There is a variety of conditions that people would come to me. Mostly, I would say, as we all, as Ayurvedic, group here would agree that digestive, system, Anavahasrota Vyadi, will be the most common one where people would come to me. Then I would say maybe 30 to 40% of my practice was people who with some kind of digestive complications where they don't find a relief from the traditional medicine or even from other forms of alternative medicine. So they would land up in my clinic or in our practice. The second thing is like mostly pertaining to autoimmune diseases. So a lot of autoimmune diseases, like it may be rheumatoid arthritis. That became one of my specialties because a lot of people around the clinic in Beverly Hills started referring patients to me. So it became a good chunk of my practice. Then, skin conditions too. People with, psoriasis, or um, even as simple as pimples to um, as complex as even pemphigoid. So what I have happened to be, connected to
Mhm.
was to the uh, people who are open-minded. Somehow, these Western doctors who are open-minded, for example, infertility and gynecological cases. So there were two people who fed me with a large number of cases once they found that something is working.
Okay.
So like that, I was fortunate enough to get these referrals.
Right.
And Ayurveda is such a beautiful medicine. It blends with any type of other modality, provided you know how to custom make it.
Right.
So that's how I would say my practice was. To answer your question directly, Shruti, digestive issues, autoimmune issues, then skin conditions. Then I would also see like a lot of children coming in with some, like, parents would come and I'll ask, oh, do you treat children as well? And yeah, and then they will bring their children.
Right.
So children would come as well.
Right.
So that's pretty much, a larger practice. But you also have specialty cases, like,
Right.
people who come in for um, during chemo or post chemotherapy,
Mm.
support. That is also one of the things that we do here.
Right.
um, yeah, so weight management people also come. So we have a variety, but definitely the first four will be the major amount of my clinical practice.
Right. So that was actually a really interesting aspect that you brought in, that in by actually collaborating with doctors from Western medicine, you were able to actually help more rogis
Mhm.
and they got referred to you. So
Mhm.
how did that happen? Because I know that in the community this is something that many practitioners want to cultivate these relationships.
Mhm.
What are some good ways for them to explore?
Yeah, patients basically. So let's say a patient has a fibroid and it's about 3 to 4 centimeters size, and there is a little bit of excessive bleeding, and they have gone to the gynecologist, and the gynecologist says, we see this. Let's observe for the next 6 months and then see if it changes. If not, we'll go in and then clip it and take it. So there is no guidance further how to prevent growing of this fibroid, or even to address that inner fear that there is something inside of me that is a potential to become something abnormal. They
Right.
will start looking, the patients would start looking into alternative care.
Right.
And one of the things that also happened is the word of mouth. We did not advertise in the university clinic which I was working for. There was no absolutely no advertisement whatsoever. But
Right.
it's a word of mouth. So patients would come and then go back to the gynecologist. They do the ultrasound scanning, and this patient who had a 4 centimeter fibroid, it had disappeared after 3.5 months or 4 months. And they said, "What did you do?"
Mm.
And they told their gynecologist here, for instance, that something happened like this.
Right.
And they say, okay, what is that? And they call and talk. And I had a opportunity. When you're communicating to other practitioners, you
Mm.
should have a good skill of Western knowledge and terminology, so that you can show that you're not acting in a very secluded fashion, but you are in a very integrative in approach. And
Right.
so that's what I think we have to develop as practitioners, how to integrate, how to be all inclusive, rather than, like, Sushruta says, ekam shastram adhyana. That means you study one science, that is good, but also have the knowledge of many, many other, sciences. So
Right.
that's how I think people came to know about my practice.
Right. That's a really good point about like having that mentality of understanding a different science and being able to communicate in a language that the other person can also understand you, right? And can actually lead to long-term collaboration. So that's great. So on a related note, right? So Ayurveda and Western medicine, like one of the issues that I see with just Ayurveda being so nascent right now is we are not covered by health insurance. A lot of yogis have to pay out of pocket to see Ayurvedic practitioners. So the access for in some sense for yogis is very limited, right? Because they have to be able to pay a certain amount of money out of pocket. How do you think that Ayurveda can continue to grow and create access for a broader population in the West?
Be very accessible. When I say accessible, you don't have to be very keen on your fee structure, because sometimes, as you said, people who want to avail Ayurveda are not in the most best, I mean, financial situations. So when you ask people to come in, have a gradient, like you can come in. I have like, if they can't do 1 hour consultations, then I will do specific condition based consultation. That's only for half hour. You don't have to spend the entire hour going through everything. We address the problem that you have. Once that is better, then you can come back sometime later to have a complete consultation. So which gives the patient a flexibility to think and act. Because one side is the consultation, another side is the supplements that you're going to give them, and the diet changes that you make. It does involve a financial burden. I usually put myself in patient's shoes and think about, would they be able to, I ask them directly, I'm doing 2 types of pills and this, is that okay? Or do you think it's too much and it'll cost this much per month? Would it be fine? And then I usually don't put them on treatments until it's absolutely necessary. So sometimes we get over enthusiastic and put panchakarmas for everybody, like, okay, come for Shirodhara, Abhyanga. That is good, if you are practicing in a affluent, society or area, that's good, but not all of them are able to do that. So consider you to be very accessible, because Ayurveda is a very divine practice. This, I think it's the only practice where a Rogi as well as a Vaidya gets, karmically uplifted. That's my consideration. So keep that in mind. You came to Ayurveda not by accident. You came to Ayurveda with a purpose. So I believe strongly in that. And when possible, I tell them, if you don't want to pay, that's fine. I'll do a phone consultation for you. Reserve your price or money to buy your supplements, and then when you feel better, you can come back. So that type of accessible approach is very important. Then when it comes to herbs too, if you can make most powerful, very pointed, combinations to address the primary complaint, what they have, and keep all, we have a tendency to do first one is roga pratyanika, the disease specific treatment, rasayana, panchakarma, everything we want to do, because for us it's all looks like very beneficial for the patient, but the patient may not be capable of affording what you're saying. Sometimes if you think, okay, I'm not doing all of it, your confidence comes down, and then you think, oh, I'm not doing panchakarma for this patient. I'm not doing the gugulu that's supposed to be. I'm not doing the gritan that I was supposed to do for this patient. Then see, Ayurveda works both ways. Your intention is very important to make your herbs work or make your protocol work. So that's your confidence and your intention. So if your intention or confidence comes down, then you will think, oh, my treatment is partial. Right. So when you plan in such a way that you're sure of these 3 things that you're doing, it's going to help them. right?
So prioritizing, so that's a really good point, and one that I think comes up in other conversations also, that as new practitioners, you do a lot of things and you want to give a lot of suggestions to the rogi, and on one level it can be overwhelming for the rogi to like do so many things, but also from a financial perspective, like to be considerate of that as well. So that's it. That's a really great point. Thank you. So I want to take a quick break. I think some people are leaving comments and questions, so we can take some of those. And then I'd love to talk to you more about, especially like you're so much, you have so much experience with, herbs and herbology and, even starting your own company. So we'll talk more about that, but let's take some questions. Michelle, who's one of our organizers at CTA, is going to help me take some of the comments and questions. Michelle, you want to?
Yes. We have a question from Om. He would like to know, what are your views on integrative health, medicine relationship to Ayurveda?
First thing is, be very transparent when you are working with other modalities. When I say transparent, let's say you are treating or working with a patient who is there for a chemo support. Let's say somebody who has come in for chemo and they're taking chemo, and as simple as they don't want to lose much hair. They're saying, oh, I somehow help me. So they'll come to you and you think about some herb, like maybe as Bringaraj, as you know, is the top herb for that. And when you do write it down, put down information that what is the herb, what is the scientific name, and are there any clinical studies to show that it has improved the symptom that the patient is experiencing. If there are any known or drug interactions that are there with the chemo, very transparent. You put down all of that and then send them. Then in that way, whoever is looking at your approach or your prescription for the herb that you have given, or they think you're very thorough, you're very informed. That brings a lot of respect among other professionals. That's the transparency I'm talking about. Don't mix, like sometimes Formula One. Nobody knows what is there in Formula One. And it's not fair to do that as well, because you're keeping something, not disclosing to your patients, and the patient may not, feel comfortable telling their in the chemotherapy, doctor or oncologist. So those things may bring validation to the science and also to your own practice. So look at how you can be very open in communication. That's the first one. Second thing is that, as I was giving you earlier examples, when somebody refers you something, a patient with some, let's say, some patient with endometriosis came to me, or a patient who was having menopause and osteoporosis, they refer to you. Then you will say, okay, my approach is diet, my approach is herbs, my approach is self-abhyanga. You write it down. So this is what I'm doing. And then send an email to them saying that I am doing these things that are okay with you, right? Because the person who is referring to you has to be informed. So inform the doctor or the health practitioner, integrative health practitioner who is willing to refer cases to you. Third thing is that you have to have the area that people are a little worried about is interactions, drug herb interactions, food herb interactions, side effects. They always come back to you and ask, are these free from heavy metals and things like that? And that's true, because there are research out there in the main journals, like even BMJ and all these have published stigmatic in research, so showing that Ayurveda has heavy metals in. Recently in Australia there was a case. So because Ayurveda is growing, everybody's eyes are on Ayurveda. So you want to not only safeguard your profession, practice, but also Ayurveda as a profession in this country. What I was saying is you have to know that drug herb interaction, and how do you explain if somebody says, hey, do you think your herbs that you're recommending is safe and free from heavy metals? You should be able to tell them, these are based companies in the US, they are tested for all of this, and I'm sure that should be fine. They're organic. If you can source organic, then that will bring some confidence in whoever is coming to you for your help. So that's the third thing. Have good sourcing for your products, and know about drug herb interactions, and tell them, okay, as far as I know, I have done the research. I'm giving Punarnava for your menopause, and that doesn't have anything to do with your pills that you're taking. So if you have that kind of a backup information, so that would be really appreciated by integrative care practitioners. So these are some things, that would be beneficial.
Wonderful. Michelle, any other?
Yes, we have another question from Grace about insurance coverage and Ayurveda. So this is a big topic right now. And if insurance begins to cover Ayurveda, it will begin to mandate and change our practice. What are your views on that?
So it is not, the insurance or licensure is not going to change your practice. Like, for example, in classical Chinese medicine, there is a large range of different practitioners coming from Korea, practitioners coming from mainland China, practitioners coming from Taiwan. They all have different, variations, and it is well accepted. But what they do is the coding that they have, that's where everything, it boils down to the coding, and then the repayment. If somebody comes to you, they'll only pay for, just say there are a set of protocols for backache. So they only pay that. Whatever extra that you do, you may not be paid. So, don't think that if Ayurveda goes into licensure, it's going to take away the whole spectrum of Ayurvedic practice. I don't think so. And it is already existing, as I gave you an example of Chinese medicine. So is, even in chiropractic, you have so many variations of chiropractic. It's accepted in complementary medicine that the possibility of variation is there. Mm-hmm. So that should be fine. I think the licensure is a necessity, because that will give Ayurveda a lot more exposure to a larger population rather than limited amount of population. I'm very pro insurance and licensure for Ayurveda.
Got it. That's a great point. So do you think that it'll also help professionalize Ayurvedic practice actually with license?
That is already happening, I think, Shruti. It's already happening, because in the past, there was no systematized education. Mm-hmm. There was smaller courses where people would do, or go to India and then come back. Now we have NAMA, which has standards, which has a entrance or a board exam that is ongoing, which is when a practice needs to be standardized, it's the education. So the education is already taking place. There are many institutes which I teach for some of the institutes, but also you're all students from different institutions here. And you can see how the Ayurveda is becoming much more a quality education. From education comes a critical mass of practitioners who are standardized. And then the licensure should be easy, should not be an issue.
Right. That's a great point. I think on the side of education and with the work NAMA is doing, we definitely see a lot of that happening. But I think what has also happened maybe a little bit with yoga and is, there is a concern that, people may have taken short-term courses, weekend courses, and are practicing and calling it Ayurveda, right?
Mm-hmm.
So how do we make sure that, there is a standard level of practice, not just education, but also practice in what a consumer or individual going for Ayurvedic consultation may get that, right?
Mm-hmm. So, it's your caliber. And if you're very well informed and very good in learning what you have learned, I think your patients will speak out to you. Your practice will not bring in, that kind of patients if you cannot handle them. So it's as simple as that. It's the your patient volume that comes to your practice.
Right.
Is what,
Right.
it takes.
Right. Right. Okay, I think, so Michelle, can we move on, or is there anything else?
Everybody says thank you. They love the answers, so please move on.
Great, thank you. All right. So actually, one more thing I want to ask you, since you were talking about like TCM and, chiropractor, I know that you also learned acupuncture, right? How did that happen?
My passion to learn herbs, that's what makes me to go into different sciences and see how do they work with the herbs. Because, the initial practice of medicine started with some dry herb or a twig that they took, and then that's how the practice started, right? That's where the healing started. So my curiosity is always that I wanted to see what do TCM, concepts of herbology are. That's the drive. So I graduated from the Masters in Acupuncture and Oriental Medicine. And that was good information for me. Sometimes it was a little counterintuitive because we use herb. There are about close to 30 to 35% overlapping between the two materia medicas. Ayurveda, like you can think of cinnamon, licorice, haritaki, pippali, vacha. All these herbs are overlapped between the two modalities. But the use is so different.
Oh,
So,
interesting.
yeah, we think in Ayurveda, we say, let's take an example of clove. Clove in Ayurveda is Shita Virya. For them, it's Ushna Virya. If you give it, it's going to cause a lot of blood aggravation. So things like that would, puzzle me sometimes. And principles are very, you can draw a common basis where Ayurvedic principles and Chinese medicine, they get to a common mode at some point. But the herbs was very interesting for me. Chinese medicine herbs are also very powerful herbs, and they also make a good complement from Ayurvedic practice as well.
Well, very interesting. So what were some other things that you found sort of puzzling or different between the two systems?
One of the things is the maybe it is the TCM versus the traditional Chinese medicine versus the licensed, acupuncture practice, where you have, I'm talking about the trained, US trained Ayurvedic, Chinese medicine or acupuncture practitioners. What we are taught is, okay, there's back pain, there are these 20 points and you needle them. Doesn't matter what type of back pain it is. So back pain due to damp heat, back pain due to wind, anything like that. You have this 20 set of points that you work. So it's almost like disease and already a fixed prescription. There's no, flexibility or variation in it. That's what I found that is happening. In Ayurveda, we have so much. Now, if somebody comes to me, I do something and then they go to another practitioner, they may do entirely different type of, and it is accepted in Ayurveda. But in Chinese medicine, there is a little bit of that restriction I see in practice. Otherwise, the diet in Chinese medicine is very minimal. When it comes to Ayurveda, between Ayurveda and yoga, Ayurveda becomes a little more, I think, this is my consideration. I'm very limited in my knowledge as well. But Ayurveda is a little more superior to me when it comes to its approach. There is mind. There is also Shen in Chinese medicine. But the way Ayurveda looks at and approaches it with yoga and other modalities, it's much more comprehensive. I feel it's more comprehensive in Ayurveda when it comes to diet and lifestyle and yoga. They do have Tai Chi, but yoga is even more accessible. So these are some differences I find between the two sciences.
Right, very interesting. Were there any herbs that you learned about through TCM and then became a more regular part of your practice or use, which normally in Ayurveda are not used?
Not many. Not many. I would just take one example of Dongquai. Dongquai is Angelica root. Dongquai is something what I personally did is, if I am not getting this herb in the US market, I replaced it with something that is in the Chinese medicine, which would match something.
Okay.
So that's what was my approach to this type of collaboration between the Chinese herbs and the Ayurvedic herbs. So Dangquai was one example. If Kushta is not available, I would use, Kushta is Sasoria lapa, which is a herb that is used for blood conditions and respiratory issues and menstrual issues. So Dangquai is definitely a very well-known Chinese tonic for uterine complaints. So I use that in combination with Ayurvedic herbs, and it gives good results too.
Right. So I think that's a very interesting point you're making about, like, Chinese herbs actually may be more available in US than Ayurvedic herbs, just given that, the practice has been around here longer. So in that way, that's a great sort of, tool to have when you're not able to find some of the Ayurvedic herbs for practice. So that's a really great point. So in terms of and you mentioned this, like, around sourcing and, practicing here in terms of herbs, when you came here and then you went on to start your own company, I'm curious, what were some things that you noticed in terms of, like, challenges with really practicing with herbs in this country?
The biggest advantage for Ayurvedic practitioners are free access to the spices. That is one of the wonderful advantages that we have. Nobody can interfere or object use of turmeric, for example, to hing, to fenugreek. You know the spices. I don't have to list them. So that is biggest advantage for an Ayurvedic practitioner. So we have free access, market availability. That something doesn't exist in other systems of medicine. So using them was the first step, where making, nowadays have become famous tea combinations, CCF, CCFT, all this. They actually are testimonials, standing testimonials for spices being incorporated in healing. And so if you use in small quantities, they are spices. If you use in large quantities, they are herbs. So that's the advantage that we have. Then other forms of herbs like ashwagandha or shatavari, and they're becoming quite known to the general population. Okay, I think thanks to turmeric, turmeric made that type of an impact. At some point, people would think, where is this herb coming from? And it's from Ayurvedic or even traditional Indian lifestyle. So they would relate to Ayurveda and see that, okay, the turmeric is safe and it should be okay to use other herbs too. That kind of a underlying confidence that grows in patients who take it, or people who take it. Right. So third group of herbs which are not known are something that will in the future will become mainstream. Because Ayurvedic practice is growing and more practitioners will start looking into other effective herbs in management of diseases. So there is, if you go into the American Plant Association, they have list of things that are approved to work with, and those which are not, which basically it's an FDA approved set of herbs that you have. So just be cautious about that and look at it. Okay, this herb that I'm using, is it approved by the FDA, or if it's not? That is something you will never know who is coming to your practice. If you are careful and well informed, then you will not run into trouble. So that's the herbal issue. Always people look at, if there's something going wrong, they will immediately say, oh, it's because of the herb that I'm taking. You should be able to substantiate and show that it has been allowed in the US to be used for humans,
Right. Okay, interesting. There are a couple of questions here. Michelle, would you like to maybe take these?
Yes, we have two questions. One is the first one on the herbs, and then there's a second one about TCM from Jaya. Ashwagandha and other off the shelf without the knowledge of one's prakriti could be detrimental. Any thoughts, Dr. Jay?
That's going to happen. Now we don't know who are all taking turmeric. According to Ayurvedic, assessment, just a simple example here. People juice raw turmeric. Nobody knows what are the long-term uses. Every day, if you take raw turmeric in the form of a smoothie, because it has benefits, it doesn't mean that you need to use it in that form or in that quantity. Nobody, has done those population studies. And even it will happen for ashwagandha and other things. If people are not taking right, precautions before they consume some of these herbal supplements. So over the counter ashwagandha, it is making Ayurveda known to the public, but is it the right way? I don't think so. It's something that over some time, as Ayurvedic community, we need to voice this and tell people that there are certain parameters or certain considerations the patient or whoever is consuming should have, or print on the label, if you have these things, don't take ashwagandha or something like that. So that I think as we have to, as a community, have to reinforce that.
Thank you. We have one more question from Shagun. Dr. Jay, since you are knowledgeable in both TCM and Ayurveda, could you comment on how you do tongue diagnosis, as Ayurveda does not look for organ malfunction in the tongue areas, whereas TCM does?
Very specific question. Tongue diagnosis, even we see that some of the modern, contemplation of, tongue diagnosis or pulse diagnosis, they bring in organs which can be referred back to indirectly. Like if you are looking at Rakta, you can think of the Yakrit and Pliha, that, those can be, because they are the regulating organs or Srotomula for the Rakta Vasrotas. You can refer back to them indirectly, but I don't think in any of the classical textbooks you will find Jihva Pariksha that is based on anatomy. No. Also, pulse is not based on anatomy of organs. No. What you see is, you will see the relation to the tongue coating, to that of tongue shape, to that of the mouth odor, the odor. Such things have been taken into consideration in Ayurveda rather than specific organs. I am not an expert in TCM, tongue diagnosis. I went through all the training, but it is very detailed. There is characteristics that have been explained in the classical Chinese textbooks, which some way are adopted into Ayurveda in the modern times. But in traditional classical or textbooks, in classical textbooks, they always looked into the dosha prevalence and the general appearance of the tongue, general coating on the tongue, such things rather than organs.
So one follow-up on, I think, herbs and use of herbs. In your practice, do you tend to do more custom herb blends or classical formulations?
I started off with single herbs because now we have a lot of compound herbs and formulations available thanks to all the companies that they are importing some of the wonderful formulas. I started off with just single herb combinations. I also learned my ways as well. I was over enthusiastic and over prescribing combinations of herbs that are absolutely not palatable to anybody. Thinking that I want to tackle this dosha dusha samurchana, I used to do these strong combinations, and I learned my ways because people would not be compliant. Gradually, I had to go to capsule formations and capsule combinations where people would bypass their taste hesitation. But my preference has been single herb, and single herbs work like magic to me. My practice is mostly single herbs, and if sometimes it's combination of few herbs made into a tea, made into a honey paste, made into a capsule for that matter. And that seems to be my niche of doing herbs.
So with Athreya herbs also, do you do more single herbs or are there also formulations that you're doing?
It started off with single herbs. It would never intention to start a company. Some of my own patients said, why we get the herbs? It takes 2 weeks, 3 weeks to get them from wherever they are. Why don't you start something? And then that's how Athreya herbs came into picture. It started off with single herbs. Then because of the community that supports Athreya herbs, we started importing other formulations from traditional pharmacies, honoring their techniques and traditions. We have some companies that manufacture for us. So both, we have 70 odd single herbs and then maybe 50 odd compound herbs.
Okay, very interesting. And are you mostly sourcing from India or other places also?
No, mostly from India right now. Mostly from India. One is the authenticity of the product. Second thing is the cost effectiveness. If you bring from other countries or grow in the US, then you have to think about cost factor.
Okay. So in terms of more local sourcing, what do you think needs to happen for that to become cost effective or for more local herbs to be used?
One is market demand. If you grow something, if there is a demand. Now, I think you could grow ashwagandha because ashwagandha has become quite a name. And farming ashwagandha in right topological conditions where it is somewhat similar to where it is growing in India, that may be possible here in the US. You can grow it. If it is large amounts, then the agriculture supports the product that you're growing or the raw material that you're growing. If it is a small market, you have a larger product and then you may lose the product without, raw material being converted into a product. So we are at that bottleneck now. I think some of the herbs will start growing,
Yeah.
will be grown here. And the secret will be to grow in the exact same conditions that it grows naturally in India.
Right. Otherwise, the gunas are going to change.
Yeah. Yeah.
Right. Right. Okay. Very interesting. All right. So we have 10 more minutes left, and maybe we may want to take some more questions at the end. So one of the things I would love to cover with you, Dr. J, is, understand more about you as a teacher as well as student of Ayurveda, right? So what are some things that you're trying to learn right now?
That's a tall order. What am I learning? Sometimes I feel so small. I get up and I was about to teach and I think, oh, I don't know about this. And then I start looking in. That's the love towards, I have love towards Ayurveda. It keeps you always on that mode of, hunger for learning. If it dies down, then your zeal for Ayurveda is going down, I think. So I always learn. I try to even today I try to mug up, or I try to memorize some of the shlokas that are there that I feel like they're so fascinating. I wish I would know this when I'm with a patient. Those moments will come in my mind. Oh, what if I had known Guruji is this? It has the Rasayana quality, but also this. So things like that will always keep an Ayurvedic practitioner very enthusiastic in learning Ayurveda. So I think I'm learning as my interest in Ayurvedic herbs is there, but allow diagnosis. I contemplate how we can use the same classical principles or theories and develop new extensions of it without compromising the ancient theories. That's one of my deepest desires. If I do pulse diagnosis, I want to bring everything according to the principles of Ayurveda, not anything that is a new concept or a hybridization. So that is one of my things that I learn in that way. I always think about how can I explain this in the principles that I already know about Ayurveda, or the theories that I know about Ayurveda.
Right.
How about teaching? I have a passion for teaching. I love to teach. I have that desire to give everything that I have to somebody who's aspiring to learn Ayurveda. That will exist as long as my Ayurvedic career exists. I would like to teach. There's no question.
Do you sort of equally spend time between seeing Rogis, teaching, and with Athreya herbs?
Yeah. Time is limited, and I feel that I'm wearing too many hats, and we are very big on our own gardening. We have gardening work, and we grow all our vegetables through spring to fall. I have also a very active son. We play and things like that. Sometimes I feel like I'm overwhelming myself or overdoing myself, but there is a need to do that somehow. You can see most of Ayurvedic doctors who have come from India, the Vaidyas who have come from India, they're juggling between this and that and this. That's because there's like so much to be enthusiastic about, or like, I want to offer this, I want to offer that. That happens as long as you maintain a balance. It should be okay. I do practice 5 days a week. One day in that 5 days is at the University, Southern California University of Health Sciences in Whittier. That's where the university is located. I teach there. Students intern with me. And on weekends, most of the classes, I teach 4 modules for the university. that is, herbology, nutrition, intramedicine, and, clinics. So these are the four things that I teach. Then other institutions I teach as well. So teaching is mostly on weekends. I teach 2 weekends a week, a month, and then 2 weekends I keep for myself for whatever private, things that I need to do for myself and my family. So I try to bring balance. And when it comes to herba, the company, herb company, Athreya Herbs, I have dedicated a lot of time in the beginning. Now we have all the organic sources, our farmers, everything is in place. Now it is all streamlined. So it doesn't require a lot of time until unless I need to make a new formula or something like that.
Right.
Otherwise, now I think I am in a place where teaching and practice has become my more dedicated work.
Okay. Are there any lifestyle practices that you follow every day to keep your balance?
My day starts at between 4 and 4:30. I have a good, decent Ayurvedic routine. I do, there is no single day that I don't get out without doing simple as Abhyanga to Karnapurna or Gundusha. They rotate sometimes. If I have no time, I don't do all of them, but Abhyanga is I want to, definitely want to see all our listeners here. Just, doing Abhyanga is to carry Ayurveda on you. That's what I see. Ayurveda is like surrounding you when you put your oil on, rub yourself, put the herbal powder, take a shower, and then go. It gives that inner, not confidence, but your being, your mind, body, spirit gets uplifted when you have such type of desire to do things for yourself. So then, cooking the meals, and me and my wife, we both love to cook. So I have a practice like that, and I want to, just for all the practitioners here, take up fasting. One advice that I have seen in my own experience is that take up fasting on a day that is favorable to Dhanvantari, because Ayurvedic practice is a very spiritual practice, and fasting is something that you want to incorporate as a dedication to your inner guidance. The Dhanvantari is your inner guidance for healing, and you take out one part of your month or a week, something like that, and fast and dedicate that fasting to the deity or the healing in you. So that's something I do too.
Very nice. Wonderful. There are a few questions. Is it okay if we may go a little bit over, Dr. J, or do you have?
Yeah, I have a patient at 10, but okay, we can be five minutes.
We'll wrap up quickly then. So maybe let's take 1 or 2 questions, Michelle.
Deepa Reddy is asking, how do we apply for internship at your clinic?
Right now, I am not, my clinic is not a very big clinic. Have 4 treatment rooms and a consultation room. Right now, I am thinking to offer internship, but I'm not equipped to offer it because post-COVID, before COVID, we had internship opportunity, but post-COVID, we are just trying to staff ourselves because some of my staff left. I had to let them go. So we are trying to balance it out before we offer something like that where interns can come in, and then it's well-structured program for them to intern here.
Very nice.
If you have time.
Sorry, Michelle. If at all we are offering, it will be there on our website, internship opportunity. You can check out on our website.
Okay.
Thank you.
Great.
Quickly, there's one more question before we finish off, if there's time. Where do you see Ayurveda in the next 10 years?
Exponential growth. One of the most favorite systems of medicine in general public, with a lot of potential to grow. We, each one of us here in this group, have to uplift this science. We have to do our due diligence and offering the most genuine Ayurvedic practice and spreading the word and communicating to as many people, creating larger community of Ayurveda. Ayurveda is going to be, Ayurveda is here to stay. That's what I'm going to say. 10 years, it's going to be like you will be thinking about what I said.
Wonderful. On that lovely note, we will wrap up for today. Dr. J, we don't want to keep your patient waiting. So thank you so much for joining us today, everybody. Lovely to see you all here. We do have a couple of other events coming up later this month, including our community hours on the last Friday of the month, and then book club next month in March. So stay tuned, and hope to see you all for the next episode of In Conversation with Vaidya next month. Thank you, everybody, for joining.
Thank you. Thank you so much for having me, Shruti ji.
Thank you.
And I hope that we'll meet again. Thank you. Namaste, everyone.
Namaste.